Hi, my name is Sylvia, and today I'm going to be shooting my sinus trigger. We're going to have 4 projections: the lateral, Caldwell, the waters, and the SMV. So before I get started, I am going to clean off my bucky, make sure it's clean because my patient is going to have their face against this. I'm going to need to use a sponge, so I'm going to clean that off as well. Gonna need a shield for when my patient gets here, and last I'm going to detent my tube to 40 SID. And this is the SID we'll be using for all 4 images. And now I'm gonna go get my patient. Miss Garcia?
Yes.
Hi, my name is Sylvia. I'll be doing your examination today.
Okay.
What is your full name?
My name is Carmen Garcia.
And your date of birth?
It's February 25th, 1960.
And is there any possibility of pregnancy?
No.
Okay. So before we get started, I just need to know if you have any dentures or hair clips on or anything that's going to obstruct the image. Okay. So let's go ahead and put this apron on you.
In my head?
No, around your waist.
Okay.
Can you help me? Alright. Then I'm going to have you come stand over here. And I want you to face me. So we're going to begin with our right lateral position. First, I'm going to have the patient face me in a lateral position. So let's take a step forward. And then in order to get my patient's head closer to the bucky, I'm going to have her turn into an RAO position. Okay, so now my patient's interpupillary line and IOML are perpendicular to the bucky, and my central ray is going to be 1.5 to 1 inch posterior to the outer campus, and her mid-sagittal plane is parallel to the IR, and I have my right marker up here. This is a right lateral, and since this is just the lateral sinus, I'm gonna collimate a little because I don't need the entire cranium. And the technique I'm going to use is 80 at 10 mass. My patient's shielded, so Miss Garcia, go ahead and hold your breath. Beep. Now breathe. And we're going to move on to the next projection. You can relax. This next projection is my PA Caldwell. And since this is for the sinuses, there will be no angle on the tube. The central ray is going to be horizontal and exiting the nasion. But we still need a 15-degree angle from my patient's head to the IR, so I'm going to use this sponge. So go ahead and step forward and lean your forehead and your nose against the bucky. Okay, now lean your forehead against the sponge. place my left marker on the patient's left side. Then again, I'm going to cone down a little because we don't need the entire skull. Okay, and the technique I'll use for this is about 80 kV at 12 mass, and my patient's shielded. And again, all these images are at 40 SID. So now I'm going to give my patient breathing instructions. So go ahead and hold your breath, beep, and breathe. You can relax. Now on to the next image. So the next projection we're going to do is the Waters method. So Miss Garcia, stand right here. And I'm going to start by placing my patient's chin on the bucky. Tilt your head up. And this will help a little more. And this will form a 37-degree angle with my patient's OML to the IR, and my patient's mental meatal line is perpendicular to the bucky, and the central ray is entering horizontal and exiting at the acanthion. And let's see, the technique I would use for this is 80 at 12, and my collimation is 8 by 10, but again, I don't need her entire skull, so I'm going to cone in. And this is my patient's left side. So I'm going to place my left marker. And my patient's shielded, so now I'm going to go ahead and give breathing instructions. So go ahead and hold your breath, beep, and breathe and relax. Now I'm on to my final projection, and once again my patient is shielded. I'm going to have my right marker on the right side of the patient. The technique I'm going to use is 80 at 15, and my tube is detented to 40. So now I'm going to go ahead and position my patient. So go ahead and tilt your head back. Okay. So I want my patient's now positioned, and her IOML is parallel to the IR. And the central ray is going to enter 3/4 above her EAM. Just a little bit. Okay. All right, and once again, this is my SMV image. And I'm going to cone in just a little bit. All right. So Miss Garcia, go ahead and hold your breath. Beep. And you can breathe. Let me help you up. And now we have completed our sinus series. Here is the image of my lateral projection. It shows evidence of proper collimation. It shows all 4 sinus groups, but the sphenoidal sinus is the best demonstrated. And here are the 4 sinus groups. Here is the frontal sinus. Here is the sphenoidal sinus back here. Here's the ethmoid sinus and the maxillary sinus. And it shows no rotation or tilt of sinus anatomy as demonstrated by the sella turcica in profile, the superimposed orbital roofs right here, and the superimposed mandibular rami back there. And the brightness and contrast is sufficient to visualize air fluid levels. So here is the image for my PA axial projection, also known as the Caldwell method, and it shows evidence of proper collimation. It shows the frontal sinus line above the frontal nasal suture, the frontal sinus, and it shows the anterior ethmoidal air cells line above the petrous ridges. So here's the ethmoid sinus, and here are the petrous ridges, which are lying in the lower 1/3 portion of the orbit. And it shows no rotation or tilt, demonstrated by equal distance between the lateral border of the skull and the lateral border of the orbits. And the petrous ridges are symmetric on both sides. And the mid-sagittal plane of the head is aligned with the long axis of collimated field. And brightness and contrast is sufficient to visualize air fluid levels if present. Here is the image for my parietocanthial projection. It's also known as the Waters method. It shows evidence of proper collimation. It shows the maxillary sinuses. It shows the OML in proper position, and this is demonstrated by the petrous pyramids line immediately inferior to the floor of the sinuses. And it shows no rotation or tilt, and this is demonstrated by equal distance between the lateral border of the skull and the lateral border of the orbit on both sides. This is also demonstrated by the orbits and maxillary sinuses symmetric on each side. And the mid-sagittal plane of the head is aligned with the long axis of collimated field. And it also shows brightness and contrast sufficient to visualize air fluid levels if present. Here is my last and final image, and this is for the submento vertical projection, also known as SMV for short. It shows evidence of proper collimation. It shows the sphenoid and ethmoid sinuses. Here are the ethmoid sinuses up here, and the sphenoid sinus down here. And it shows no tilt, and this is demonstrated by equal distance from the lateral border of the skull to the mandibular condyles on both sides. The IOML is positioned parallel to the IR, and this is demonstrated by superimposition of anterior frontal bone by mental protuberance. Insufficient neck extension will cause mandible to superimpose ethmoid sinuses. Mandibular condyle anterior to petrous pyramids, and brightness and contrast is sufficient to visualize air fluid levels if present.